Ashton, you ready to get ready? You ready to get going, I guess?
I'm sorry, I was double muted. We are ready for you, Dr. Priest.
All right, good morning, everybody. It's Dave. I think I'm alone today. Really, no one wanted to share with me today. Must be a difficult personality to work with. So thanks for jumping on today. We'll give you an update on our hospitals and our vaccines, and then take what questions you have. So for our hospital update this morning, we have 278 patients in our acute care facilities with COVID. Roughly 11% of those are requiring ventilators. Again, that's much improved from our peaks 4 and 5 weeks ago, where we had 550 or more patients across our hospital system. We do continue to see day-over-day declines in positive cases, and our 7-day rolling positivity rate is about 11% in our Charlotte market and around 15% in our Winston-Salem market. Remember, there were times that was between 20 and 25%. Our internal models suggest that we will continue to see a decline in our hospital census over the next 14 days. This likely will get us to where we were during the peaks of last summer. So remember, we thought the peaks last summer were pretty high. We're still well above that, but we'll be getting toward that number over the next couple of weeks, we hope. We're encouraged by these trends, but we know that we have a long way to go in getting to that herd immunity number that we need in our communities. We'll be waiting to see what impact large gatherings related to the Super Bowl or other fan celebrations have on our COVID numbers. We've heard on college campuses and a number of colleges in the state of North Carolina, there have been outbreaks. And we don't know what role variants that are spreading could have on our overall additional cases. We'll be watching that closely. As of this morning, we've administered more than 74,000 doses of vaccine, including more than 19,000 second doses. So we did receive 12,850 doses for this week, including 4,070 for mass event and equity doses. We've been vaccinating patients for a little over a month now, and many of our community members are now receiving their second doses of the vaccine. Remember, we've said from the beginning that there are what we call expected effects from vaccination as your immune system responds to the vaccine. Those can be a little more prominent after the second dose, so we've heard that, but usually within a few hours, those symptoms go away. People may have a sore arm, some low-grade fever, occasionally even a rash. One common question we're getting pretty frequently is can I take anti-inflammatories like ibuprofen, which is Motrin, or Tylenol around the time of vaccine? The current recommendation is to not take those agents prior to the vaccine, but you are able to take them after you get the vaccine. The reason for that is there's a little bit of medical literature, particularly in children, that suggests that anti-inflammatories may make your vaccine response a little less vigorous. Now, if you took those agents before getting your vaccine, it's nothing to worry about. We don't think it's a significant impact on vaccine response. There's no need to check an antibody test after your vaccine or get it again or do the series again. But just as a general rule, we try to tell people not to take anti-inflammatories before they get vaccine. If you're someone who has to take anti-inflammatories chronically, you should talk to your doctor before stopping those. So we're not overly concerned, but if you want to maximize that vaccine response, it's worth waiting until after you get your shot to take them. In terms of our community vaccination programs, we've now hosted community pop-up vaccination events over 3 weekends in Winston-Salem and in Charlotte. We've vaccinated more than 1,000 people. We'll continue to rotate among our church and school partners in both Winston-Salem and Charlotte, and we will target one location in each community per weekend. Over this past weekend, we partnered with Galilee Missionary Baptist Church in Winston-Salem to vaccinate about 179 community members. We hosted our first vaccination event with Charlotte and Mecklenburg County Schools at McClintock Middle School in Charlotte, vaccinated about 165 people there. And we hosted our first mass vaccination event at the Park Expo in Charlotte, vaccinating more than 3,500 people. This Wednesday, we're hosting a community pop-up event at Paisley Middle School in Winston-Salem. It's in partnership with the Winston-Salem County Forsyth Schools, or Winston-Salem Forsyth County Schools, I should say. We'll vaccinate school system employees and community members there who are over the age of 65 who are currently in that group 2. This Saturday, we're hosting vaccination events in Winston-Salem, Salisbury, and Charlotte. In Winston-Salem, we'll return to Union Baptist Church. We'll have more details to share about the Salisbury event a little later this week. Our teams are working to plan community vaccination events and to ensure we're poised to mobilize as soon as we receive confirmation of our weekly allocation, as we do each week from the state. So we're eager for the day when we can fully leverage our vaccination sites. We can certainly vaccinate more community members. We'd love to get to that 20,000 doses a day mark. Until then, we do believe every dose matters. And so sometimes when you hear in a community event, oh, you did 180, you did 200, that sounds like a small number. But we're returning to those sites to give second doses. And when you go, as we've said before, when you go to these events and you see how people respond and how grateful they are, you realize sometimes small events are a really important piece of our vaccination efforts in communities, because these small events are in locations that our community members trust, places they frequent, places they want to be. And so we think all sizes of vaccine events are important. And I can tell you from personal experience, the sense of relief and hope that you get when you get that second vaccine. And so as an organization, we're committed to getting everyone, we won't stop vaccinating until everyone who wants a vaccine gets it. A little update on our Spectrum event that's coming up. So we're excited. Our plans are underway for the vaccination event at the Spectrum Center this Saturday, February 13th. We've received a separate allocation from the state of North Carolina of a little more than 2,000 doses to host this event. We're grateful to the Charlotte Hornets and Spectrum Center teams for their partnership and collaboration to help our team put our plans into action. As you know, the location is phenomenal. We have public transportation, we have nearby parking. It's one of the more accessible locations in Uptown Charlotte. So accessibility for all community members, regardless of zip code, is a priority to us. And this is a really wonderful location to utilize. We're very excited about the event. The reality is our appointments are limited by our allocation. So we'll be working with the Charlotte-Mecklenburg County schools and community partners to fill those appointment slots for those who are currently eligible. So teachers and CMS staff who are 65 years of age and older, community heroes like EMTs who've not yet received their vaccine, and other 65 and older community members will be among those who will vaccinate at the event. Unfortunately, at this time, there's not a way for the general public to sign up given our supply, but if this changes, we'll be sure to communicate how that can be done. We'll be back at the Spectrum Center 3 weeks from Saturday for second doses, and we'll continue working to activate additional mass vaccination events to help the state and our communities achieve higher rates of vaccination. It's also important to remember that we continue to vaccinate our eligible community members throughout the week, whether it be at a community pop-up event or through our vaccination site. So we want the community to make sure they do schedule an appointment as soon as they're able, and keep in mind all the different venues that we have available to them. So I can't really underscore that enough. For those who are able to access it, the MyChart app is the best way to view appointment availabilities and the schedule. We have ways to do that via phone. We're reaching out proactively to our patients as well to make sure they understand they're eligible to get a vaccine when they're in group. So with that, I'll stop and take whatever questions you have this morning.
Thanks, Dr. Priest. Our first question is from Richard Kraber with the Winston-Salem Journal.
Excuse me. Hello, Dr. Priest. I actually have one small and one a little bit bigger question. Can you say how far out appointments have been filled?
Yeah, so my understanding is, this is a little bit of a moving target because of allotments, that we've gone out into May and June, and I've had patients say, boy, that seems like a long way out. I'm very hopeful those appointments will steadily get moved up. I think if you have the opportunity, it's best to go ahead and get in queue, and you say, well, I don't want to wait till May, and we don't want to wait till May either, but at least you kind of get in line, as it were. And I think as more vaccine is available to us, the line moves forward, and hopefully we'll move faster than those dates. But we want to go ahead and get people in queue. We want to reassure them that vaccine is coming. Like we said earlier, everybody wants a vaccine, is going to get one. So while we understand that seems far out, I do think it's going to move up as allotment increases and as hopefully new vaccine products come to market.
Okay, and then the second question is, with the DHHS vaccination dashboard coming out Friday and starting to giving out county level demographics, looks like across the state, and including for Forsyth and probably the same thing in Mecklenburg, there's a pretty low percentage of Hispanic vaccinations. Can you kind of get a sense for why that is?
Yeah, so I think there are probably a number of things that play into that in a number of communities within the state. You know, one is just historical health inequities. Sometimes in our Hispanic communities, people have not had access to health care. They don't have a regular primary care physician. Sometimes transportation is an issue. And so we're working to address all of those things by putting on the materials we have in Spanish, having active outreach to that community, putting vaccination events in nearby areas. So definitely a concern. I know it's a concern of the state. because we've said from the beginning, diversity inclusion certainly is a big part of what we do at Novant Health. And I can tell you I'm on the state vaccination calls, and this is discussed frequently, and the state and all the healthcare systems are working on that. It's important, whether it's the Black community, the Hispanic community, to get to those places. We think our pop-up events are going to help, and we have individuals who are part of those communities who are advocating for vaccines. So I think that's going to get better, but it certainly is a part of everyone's strategy.
Thank you.
Thanks, Dr. Priest. Next question is from Tina Terry with WSOC.
Hello, Dr. Priest. Thank you so much for your time. As usual, we appreciate this. I wanted you to clarify some of the comments you made about the Spectrum event. Are you saying that none of the appointments are filled yet for that event? And are you saying that you will only be vaccinating CMS teachers, or teachers, I should say?
Sorry, I lost you there.
Will you be vaccinating only teachers at that event? And are all of the appointments full at this point, or are they still open?
Yeah, they're currently in the process of being filled, and it's not just teachers. They're among those to be vaccinated, but others that are within the group, 65 and older, will also be vaccinated as well.
And you said that the appointments are not open to the general public. What does that mean?
You have to have a Novant physician and be in our system as part of that process to get those patients in. So in other words, you can't be outside the system right now and get an appointment just because of the limitations on the amount of vaccine.
Next question is from Chloe with WCNC.
Hi, thanks for doing this. Another question about Spectrum. I guess, you had said earlier the allocation for this week was 12,000 plus doses. So why will only like the 2,000 that you all got separately? Or is that correct that only 2,000 will be used at Spectrum?
Yeah, so the state gives a certain allotment specifically for these kind of mass vaccination events. And so that's the allotment we received for that event. The other doses are used at all of our other settings, the Sears building in Winston-Salem. I mean, we have to, spread the doses around to all the locations we're giving vaccine. And that was the allotment that was given as a separate allotment from our usual baseline specifically for that event.
Next question is from Vanessa with WCNC.
Hi, good morning, Dr. Priest, and good morning to everyone. Actually, I have two questions. I'm going to start with my vaccination question first, and then I'll have a metrics follow-up afterwards. From sitting in on those state vaccine calls, have you gotten any idea of how far through groups 1 and 2 we are, and at what point we'd move on to the next group?
I haven't. I mean, I can't believe we're too far through it. I mean, I can tell you Novant Health as an organization has something like 150,000 patients in our panel over the age of 75. And when the state gets only 120,000 doses a week, you start to realize kind of the numbers we're dealing with. And now you open it up to those 65 and older. So I don't have a sense yet of when they're going to say, okay, we've moved through this group enough to say it's time for group 3 essential workers. So we hope that comes soon. We hope that comes with more vaccine. I think if the Johnson & Johnson product gets allotted or gets an emergency use authorization from the FDA and then gets allotted, that will certainly help relieve a lot of this. But I don't have a sense of when they think we might move to group 3.
Thank you for that. And then my metrics follow-up here is, of course, we've been seeing the cases falling, and then eventually we saw hospitalizations follow suit. We're still seeing a rather high number of daily deaths, at least from what I can tell on our state dashboard. Why do you think that is? And then at what point would we start to see deaths also start to trend down?
Yeah, so it's a good question. And it's because when people are diagnosed with COVID, it often, if they're going to do poorly, it takes some time, right? So what happens is it's kind of a natural order of things. Your patient's test is positive. over several days. They may improve, they may not improve. If they don't improve, they start to get worse. They have to be hospitalized. Often when patients are admitted with COVID, they're in the hospital for some time, might be several weeks. Maybe they're in the ICU, maybe they're on a ventilator. And then unfortunately, if they don't do well and they die in the hospital, then that takes maybe even a couple more weeks. So you can see the natural progression of things from a positive test to a hospitalization to death, and it's going to go the other way when the numbers come down, right? So eventually, over time, the positive tests go down, which leads to fewer hospitalizations, which leads to fewer deaths. But you saw the giant peak we had after the holidays. And so the deaths you're seeing reflected now in numbers are patients who were often acquired COVID or were diagnosed after mass holiday events. And it takes this long for the clinical course to run its course, often have prolonged, difficult hospitalizations and ICU stays, and then unfortunately die. So we'll probably see the reverse over time, and as the cases go down, hospitalizations will go down, and then deaths will follow.
Thank you.
Thanks, Dr. Priest. Next question is from Caroline Hicks with WBTV.
Hi, thank you. I think you had mentioned, or at some point, maybe it was last week, that your special event allocation was 4,000. Is that still correct? And you're just using 2,000 of it for Spectrum? And then also just to clarify the Spectrum event. So it sounds like if you're a Novant patient, or if you are a teacher or one of these members of these churches that are involved, those are kind of the people targeted for this. Are there any specific churches like closer to the Spectrum Center that you guys are working with for this event as compared to Park Expo, or is it the same churches?
Yeah, so we probably should, when we report these numbers, should divide it out. So they give you a mass vaccination group, and they also give you a group of vaccine for equity. So you get into parts of the community that maybe have not had the opportunity to get vaccinated. So that's the 2,000s, the mass vaccination event piece. When I think when we reported 4,000, that included also the equity doses that we're using in churches and those kind of things. To this question about Spectrum Center, and maybe one of our PR folks on the call know this, I'm unaware that we're specifically partnering with a church in the vicinity for that event. Those events have typically been separate events. Others may know better than I do, but I'm not aware of a specific church partnership with that event.
Hey,
Hey,
Dr. Priest.
it's Megan.
Go ahead, Megan.
That's correct. We're not partnering with one specific or a group of specific churches, but we'll follow up with you offline about kind of the process of community appointment.
Thanks, Megan. Next question is Alex with WCNC.
Hey, Dr. Priest, thanks a lot for doing this. I just had a question about the extra doses that are in each vial that were discovered at some point, I think in December. Just wanted to get a sense of how successful Novant has been at getting that extra dose. Are there challenges, and does it require some extra training? Have you guys had to train whoever preps the people taking the vaccines out of the vial? Any information about the process of getting those extra doses out of, for sure, the Pfizer vial, and I've even heard that the Moderna one can have an extra vial as well.
Yeah, so good question. We've had pretty good success with it. It's not every single vial. Most of the time you can get an extra dose. Every once in a while, I think they've gotten an extra 2 doses, and then occasionally you don't get an extra dose. So it just has to do with how the vial is manufactured, how much extra they allow for in the process of drawing up the dose. And so we, like other systems, have been pretty successful in getting an additional dose from each vial. You have to be careful, though, in how you're going to count those, because you're not guaranteed that every vial will get that. So it's nice to have those extra doses. We generally try to line up the appointments accounting for that dose, but it hasn't required any necessarily special training. It just happens to be what we're able to get out of the vial in that particular day.
Thank you.
Next question is Hannah Smoot with the Charlotte Observer.
Hi, Dr. Priest. I just wanted to clarify, sorry, the CMS teachers, do they also need to be current Novant patients, or is that current Novant patients and those people prioritized by CMS and local healthcare workers?
Yeah, they don't need to be. We're working in conjunction with a number of school systems to offer vaccine to folks in phase, so they don't necessarily have to be Novant patients for that group.
Next question is Ann Wyatt Little at Fox 46.
Yeah, hi, thank you for taking my question. I know you said you don't know the role the variants that are popping up will have on the caseload, but what's your biggest concern about variants as we move forward?
Yeah, so the variant question, I think one is we can assume that variants are in our communities. I mean, it's just the nature of how this virus operates. And in the United States, we haven't done a whole lot of genetic sequencing. We've only genetically sequenced a very, very small number of viral isolates. I think the country is catching up. But I think what you're going to see over time is various reports in the media about we found this variant here, we found this variant there. Some of the variants spread from other parts of the world, and some of them develop independently within the United States. So I'm not surprised on any media report that says, oh, we found this variant in this location. The danger with variants is, one is some are more contagious. So they've evolved over time or had a mutation where the spike protein interacts with human cells more effectively, therefore making the variant more contagious. So even if it doesn't make people sicker, if it's more contagious, we run the risk of having more cases and having another peak and putting more people in the hospital because we haven't gotten everybody immunized or don't have the herd immunity we yet need. So that's a danger. A variant that makes people more ill is also a concern. And certainly a variant that would infect people who had already been vaccinated is a concern. To date, we think the current vaccines provide significant protection against the variants that we're aware of, or even if it's not quite as high as it was during the clinical trials. We still think there's significant protection. So what we've got to do is get as many people vaccinated as quickly as possible, because we're in a little bit of a race here, because over time those variants, they're going to come and they're already here. So it behooves us to continue to wear masks, to be socially distanced, wash our hands, be careful, and get vaccinated and vaccinate as fast as we can. And that's what we're doing as an organization. And the other thing I'll add to the question is, I think sometimes people say, well, I see this variant makes this vaccine not quite as effective. And that may be true over time. We may discover that. But what we know from flu vaccination is, while how effective a particular vaccine is important, it's equally important, if not more important, about the number of people who get it. In other words, the flu vaccine every year maybe is 40% effective. People say, well, I'm not going to get it. It's only 40% effective. But if every eligible person got it, we'd have almost no flu mortality in a typical year. The idea that we have vaccines now for COVID that are 95% effective is remarkable when you think about what we have to compare it to. If a variant comes along and makes it 75% effective, it's still very effective. And it often comes down to more people getting it, right? If we had a vaccine that was 25% effective that everyone got, it would be really good at preventing disease and mortality, versus a vaccine that's 95% effective that 10% of the people get. So it's not just how effective a vaccine is, it's also how many people get it, and you can overcome less effectiveness if everybody gets it.
Vanessa from WCNC had another question.
Hi, I'm sorry, I come with all these metrics questions, but that's my beat. So, okay, please tell me if this is, kind of just like way into the weeds, but I had a revelation recently when DHEC said that they were switching their calculation of percent positive and how they measured it. Are you aware with the difference between tests over tests, people over people, and people over tests, where the term people is the weeding out of duplicate tests when you calculate percent positive? If so, are you aware of a preferable method of calculation for this metric?
Yeah, so it's an interesting question. I don't know if that I have a preference over it. I mean, our hope is people aren't having a lot of repeat tests. I mean, we know it happens, and we know that could potentially impact a percentage that's positive. But after someone has a positive test, CDC recommends not repeating that for 90 days in current state. And you say, well, why is that? Well, it's because people can after about 10 days are no longer contagious. But mRNA from the virus can stay in your nasopharynx for weeks on end, even when you're not contagious. So PCR testing is really sensitive. It runs through a certain number of cycle thresholds. And we know that the more cycle thresholds it takes, meaning the more times the test has to cycle to amplify that RNA, the less RNA is there and the less likely people are to be contagious. So I do understand how that would influence numbers, but our message to our clinicians is don't keep repeating tests. There may be specific clinical scenarios where that has to be done, but for the most part, once you have a positive test, don't keep repeating it because it could potentially skew numbers, but we hope that's not a major part of this.
Thank you for tackling that.
Thanks, Dr. Priest. I know we have a couple of follow-up questions. I did want to give Ford Hatchett with WXII an opportunity to ask a question, and then we'll go into a couple follow-ups.
Thank you, I appreciate it. Just wanted, I know you mentioned college campuses just a little bit earlier and seeing spikes. Specifically here in the Triad, we've already seen Wake Forest just in the first 2 weeks up over 300 cases. How big of a concern is that on college campuses now as students start to return and probably gather again as they get back to campus?
Yeah, I mean, it's always a concern, right? Whether it's colleges or any other venue where large numbers of people are gathering. And, we're certainly aware of that. And I won't say how old I am, but I remember being that age and I understand the pressures and the things that go into college life. And but what we're asking is people just to hold on a little bit longer. If we can get down to everybody in the community getting their vaccine, this will be a lot easier to deal with. And so anything, whether it's a college campus or a sporting event or a celebration of some kind, has the potential to spread the virus and spread it to a lot of people. And I think our colleges are seeing that. Look, there's testing fatigue, there's COVID fatigue. People want to get out, they're getting back from break and they want to see their friends. And we understand that. We encourage everybody to continue to try to do that as safely as they possibly can.
Thank you.
Caroline Hicks with WBTV had another question.
Thank you. Obviously, Spectrum Center is a huge space. Can you talk about, in the future, if you guys were to get a larger allocation, would you hope to be able to scale up operations there? And kind of what are you hoping moving forward in terms of getting more vaccines so you can do these events on a larger scale?
Yeah, absolutely. I mean, what a great venue that is, what great partners Spectrum Center and the Charlotte Hornets are. And so, as you all know, when you're dealing with COVID, it's better to have big space, good airflow, room to spread out, not having a big density of people. And so when you have the opportunity to use a facility as great as that one, we would definitely love to scale up and the more doses, the better. We think that's coming. I think as the Johnson & Johnson product comes, as allotment gets to be higher in the state of North Carolina, we would anticipate more allotment for our organization as well. So it's, these events are smaller. We'd love for them to be bigger, but if you're looking for a positive in all of that, it gives us the opportunity to really get our process down and understand what works and what doesn't work, to make sure patients are protected, that our team members are protected, that the process works smoothly, that people aren't waiting for long periods of time. And there's a lot of value in that. So I would love to have 20,000 rocking through there on a Saturday. And we think we're working toward that as the allotment increases.
Thanks, Dr. Priest. Our last question is from Tina Terry with WSOC.
Thank you, Dr. Priest. I wanted to find out, as far as the vaccination clinic on this weekend at Spectrum Arena is concerned, I know you guys have talked about balance in vaccine distribution to providers in the past, and I know the event at Bank of America Stadium had about 19,000 doses. Were you expecting more for this event? Are you disappointed in the seemingly low amount of vaccine that you've gotten in comparison to that other event? And, will people be allowed to drive up to these appointments? That's my second question. Or will they be walking in?
Yeah, so, I mean, look, we always want more vaccine. This is about the amount we expected. The state has really kind of evened out week to week. We know what our baseline allotment is. We've made it clear to them these are the events we want to host. Give us as much as you're able to. That communication seems to be working well. So we always are interested in more vaccine. And look, we want everybody in the community to be vaccinated. We're not we want to be good partners with all healthcare systems, and but we also want the equitable number of doses that we think our organization ought to get based on the number of COVID patients we're caring for in the state. So we're always looking for more, and there won't be a drive-up option at Spectrum Center. That you have to come into the facility for this weekend's event.
Thanks, Dr. Priest, and thank you all for joining today. Our next briefing will be on Friday.
Thank you.